I'm going through a split.
Any interest in a part-time resident practice? No better than someone who knows what it's like to be a cardiac.
I don't think so. It's not fair. How you see me?
You're a fighter, June. I get that.
What are you telling me to do here?
I'm not. I'm just pointing out the landmines.
Are you free tonight?
You're asking me on a date.
You had 2 major health incidents. They're pushing you out.
I'm not done, Claire.
فينا ننقذ اللي بيناتنا.
ما على كيفك.
السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. Again, brothers, a couple of quick announcements. Unfortunately, we begin by offering our condolences to Brother Khatib Shahid, who recently lost his father. So we pray that Allah grants him mercy and gives him the highest place in paradise. In times of isolation, we look towards our community.
Hey, those stitches still need to come out. Maybe tomorrow after school you stop by the hospital?
Ranya's coming to get some things.
We're friends, Amira, and she's still in both of our lives.
What time is it?
It's late. Or early, depending on your point of view.
You're working?
Yeah, I'm unwinding.
Unwinding. With electrocardiography interpretation?
Okay, unless you can show me how to sleep like a stress-free toddler, yes, that is fine.
I have stress. I stress. But I also just had a really good stress reliever.
Okay.
Is that you?
What stresses do you have?
Well, still trying to impress Dr. Hunter. That's one.
Really?
Yeah.
You never seem to worry about that.
It's future Jake's problem. Current Jake is worried about how he's going to sleep with the light on. Unless you want me to go. It's okay. I can go. Try to get some sleep. You weirdo.
Hey,
Oh, do you need your office back?
this isn't my office this morning. Actually, I'm not even here.
Soap me.
Excuse me?
Mnemonic device for rapid sequence intubation, suction, O2, airways, positioning.
Medication and equipment.
That's it.
Your exam's at noon?
Yes. Oh, I called in for supplementals, but somebody had to cancel, so I told Rhoda if she needs anything, just text.
Yeah, we'll be fine, Claire. Go kill it.
"32-year-old found down, incoming."
You paged me, Rhoda.
Sorry, by mistake. It's not a peds trauma. I'm filling in for Claire, and we're just already swamped.
I have a window if you need help.
Well, we're good.
Fall to the ladder! Multiple contusions. BP's 100/80, race 130, GCS 10.
Get a doctor?
Yes, Kelsey's my daughter. I found her on the floor of the bar she owns. She closed it to renovate. Board! I did a quick neurological exam, but she'll need a CT. I don't know how long she's been there.
2 large boat IVs.
Eat fast. Start with her chest. Ray Grisham, internist at Midcrest. I would have gone to there, but it's a 20-minute ride.
This is Dr. Bishop, Chief of
Yeah, I saw you at the Trauma Association conference a few years ago. Is there any free fluid?
Your daughter is in very good hands, sir.
Fast positive, belly full of blood.
We'll give her a gram of TXA and activate MTP.
I'm calling the blood bank.
No, she's AB negative, same as me. You can use mine now.
That's not something that we do.
Well, she's not hemodynamically stable. Have either one of you ever done a direct transfusion?
I have.
I have a donor card in my wallet if you need to confirm.
Set up for a direct transfusion. Let's take every step we can, Dr. Grisham.
Thank you. Thank you.
Guy brought in his wife after a car accident. He's dazed, a little bit cut up. And she's, well...
displaced leg fracture, and when's the last time you delivered the baby?
Is she okay? And after you answer that, please tell me I can still get the epidural.
Fetal heart rate's 140. I paged OB, but...
It's okay. Come on. Contractions are how far apart?
Not very. Ben was supposed to time the vet.
It's really happening now? I just thought the accident might...
What? Push it back in, Ben. Go find someone who could get me an epidural.
You two got in an accident on your way to have a baby.
Ben ran a red.
You were yelling at me. I'm trying here, Tess. Jake, ultrasound. Oh. Her stomach's bleeding. Tess.
Ben, remember how we took those classes about how your one job is to stay calm? Yeah? I need you to do your job, Ben. My baby's gonna be okay, right?
It's not deep, just oozing.
Grab me a pair of forceps and a vacuum just in case, Arnold.
Got it.
Okay. Well, baby's heart rate looks good, but it is sunny side up, which is what, Jake?
Occiput posterior position.
Is that bad?
For the baby, no. For mom, it could mean a tougher delivery. But to answer your question, Tessa, I have to get you in a position to push. Okay, there's no time for an epidural. This baby is on its way now. All right, ready? And 1, 2, 3.
Sorry about the heavy hand before. I had a boss who used to say, what this situation needs is 2 of me and none of you. I maybe followed a little too closely in his footsteps.
Pelvic fracture wrapped.
You're both, what year?
I'm emerge PGY2.
I'm PGY1.
But this is his second residency. He was a trauma surgeon in Syria.
Oh, so you're ahead of your peers, but also behind them. It's a good thing Kelsey isn't awake to see this. She hates it when I insert myself in her life.
I'm guessing this is one time she'd make an exception.
You know, when I told her that the bar would be the death of her, I meant it was a money pit, not this.
You said you didn't know how long she was alone?
Well, I knew she was trying to get the place ready to reopen. And we hadn't talked in a few days. She used to always call her mom, but we buried her a month ago, ovarian cancer.
I'm sorry.
When it happens, you're distracted, then everybody goes. We're still figuring out not having her mom as our bridge.
Temp's 39.
I feel a lot better if her temp wasn't so high.
It could be an inflammatory response due to the trauma. We'll get Kelsey up to interventional radiology for an angioembolization to stop the pelvic bleed. And after that, just let her rest.
Okay, the baby's crowning, Mom. I just need a couple more pushes, okay?
Hang in there, Tess.
Shut up.
I thought I was supposed to...
No. Don't speak. Don't move. Don't even look at me.
Okay, Tessa, let's try one more big push.
I can't anymore. It hurts too much. Please, can you just cut it out of me? My stomach's already bleeding. You could use that opening.
The delivery I remember the most was my youngest. My wife was up all night with our oldest, who was sick with the stomach flu. She called me to tell me she was in labor, but she couldn't leave Abby home alone to come to the hospital. Okay, I drove like a maniac, and I got there just in time to deliver Grace on our kitchen floor. It was insane, just like this.
Yeah.
Okay? When we look back on it now, we laugh.
Yeah.
You two will have the same kind of story.
I don't know.
Yes, you will. But Tessa, believe me, you got this. I need you to push, okay?
Come on, we can do this.
Push. There she is. She's coming. Good. She's coming. She's coming. Here she is. Here she is. Here she is.
That's a man down.
Seriously?
Well, we'll check him out. You did it. Okay.
Congratulations.
I already gave her the head laceration.
Fracture wrist sensor imaging, back pain's on deck. Bash has a found down in 2, and...
Have you been able to find Peter?
Still looking, love. Dementia doesn't know Peter's last name or how to reach him.
Okay. I'll get him back to his room.
Sir?
Hey, if you guys are swamped, I can grab a patient. Nausea in D, already been there a while. York emergency.
Shouldn't be too long.
Miss Crawford. Hi, I'm Dr. Curtis. I hear you're feeling nauseated.
Nothing will stay down, even water. I was trying to write it out. She refused to go to the doctor. But then the cramping started, and my sister strong-armed me.
Oh, sometimes severe food poisoning can cause dehydration.
Actually, I had a gastric bypass 3 months ago. I've been sick on and off ever since. Before you ask, yes, I stick to the diet plan. Yes, I exercise. No, I don't have high blood pressure, diabetes, or heart problems.
So about this bypass, did you have that done here?
Yes, Dr. Evelyn Roche.
Okay, well, sometimes after a bypass, our stomach will react by rapidly emptying food in a way that can make you feel sick.
Dumping syndrome, I'm aware. That's only supposed to happen if you reintroduce food too fast, but I've been following the eyedropper meal plan like a zealot.
Did you let them know that in your post-op visit?
All Roche said was my system will only adjust when I commit to the lifestyle. Didn't even run a single test.
All right, well, Dr. Roche is a renowned surgeon.
She's also a jerk who has a problem with fat people. Maya. What can I say? The woman contains multitudes.
I'm going to order a CT.
You will?
I can't rule out rapid gastric emptying, but we should consider other post-surgical complications like a bowel obstruction or another acute digestive problem. In the meantime, I'm going to get you some fluids and an anti-nauseant. You'll need to change into a gown.
I'll need a second one to wrap around the back. I'll get you one in. You shouldn't have done that.
Excuse me?
Giving her false hope.
So you wanted me to tell her to exercise and eat right? Because it seems like she's already doing that.
Maya needs to hear this is normal and that she just needs to get through the worst of it. But when you don't find something, I'll have to pick her up and get her back on track.
Is there anything else?
Yes. Who can I ask for a gown?
There's this desk.
Okay.
At the end of your message, press 1.
I know you're screening me, Mel. And we need to talk about you wanting sole custody. We only speak now through lawyers, and every time I go for a pickup or drop off, your mom's there just glaring at me. I don't understand why you're treating me like this. What is it, Jake?
Ben Lyons is still complaining about left upper quadrant pain. Chest x-rays for pneumothorax and broken ribs came back normal.
Okay.
You said to rule those 2 things out.
Yes, I did. Can you think of any other organs in that quadrant which might be affected by blunt trauma?
Kidney, spleen, pancreas, but you didn't say to rule those out. Ultrasound?
CT with contrast.
CT with contrast.
So what the situation calls for is 2 of you and none of him?
You're defending him?
No, I mean, you could have walked him through your thinking.
I have, Megs. More than once. He's got to start showing up for work, which means coming to me with answers instead of questions.
Kelsey Grisham.
Her bleed's under control, but her temp's still high.
We're waiting on labs.
And her father?
Still insistent about being looped in.
I want you both to stay on this. Ray's pretty senior at Midcrest, and easier for all of us if he's managed.
Bash, about the thing that we're not, about the elevator thing, that had nothing to do with you, okay? The person in there wasn't even me, really.
Who was it?
Someone who'd had a messed up day and a messed up few months.
Well, you're not alone there. Listen, I don't want it to get between us either, so let's just pretend it never happened.
Exactly what I was gonna say.
You really gave me a scare, kid. What happened?
I was painting the crown molding.
I told you to call the contractor.
Told you I wanted to do it myself.
How you feeling now?
Headache, neck's a bit stiff, but I guess that's what happens when you lie on concrete for a few hours.
Well, we did a CT, no intracranial injury, so.
So you just fell?
Dad, the world is an imperfect place. People fall.
There's concern because you're maintaining a high fever, and we'd like to know why.
Were you feeling unwell before this? Any dizziness?
Yeah, she's always run down. Barely eats, works till 2 a.m., pouring all her energy into slinging drinks.
I'm not bartending. I'm running a business.
Look, that lifestyle was fine in your 20s, but it's time to grow up.
We can give you a minute if you...
No, it's fine. You might as well hear this. I have ALS. That's why I fell. I found out near the end with Mom.
No, that can't be right, because... Wait a minute, you're not showing any of the signs?
Recovering. I noticed I was having a hard time gripping things, and I ignored it at first, but then I started having weakness in my legs.
Do you know how advanced it is?
The neurologist said that I should expect more trouble with mobility and eating as I enter the mid-stage. And the average survival rate is 2 to 5 years, so I guess that's where we are.
Which neurologist? What's his name?
Dr. Vetter, she's been great.
Never heard of her. Joe Yoshida is a great neurologist. I'll call him and get a second opinion.
Dr. Vetter's done weeks of tests. She's sure.
Honey, you gotta trust me here. I can help us get to the bottom of this.
Dad, okay, this is why I haven't told you for so long. I have doctors. Just help me by being my dad.
Let me get Yoshida on the phone.
Did you discharge the guy at 3, the new dad?
No, actually, I was going to explain his imaging results.
I found this in his room. I called OB, and he's not there either.
We lost him? Are you guys doing okay today?
We didn't lose him. He left. And yes, we're having a small staffing issue, but we're managing just fine.
I got it.
Peter's not here yet, sir. Let's wait in your room.
Did you start her on the antibiotics? Let me call you back.
Broad spectrum until we figure out the cause of her fever.
Well, that was the neurologist I like. He advises you run a few exams to rule out ALS, spinal tap, and EMG.
Kelsey was pretty firm on not wanting to retest.
Well, she's febrile with the headache and sore neck. An LP will rule out meningitis, would it not?
Yes, and while meningitis is plausible, there are less invasive ways of narrowing down a fever.
My daughter runs on emotion, Dr. Hammond. She'll make the right choice if we lead her to it. Your boss said to do everything we can. Well, if you want sign-off, he's right over there. Talking to the co-head of Emerge at UHN of all people.
We got 3 minutes before a consult if you need me.
Yeah, actually, I just caught this patient in Emerge. She's 12 weeks post-op from the gastric bypass and nausea, vomiting, but her imaging's clear.
She's aware of dumping syndrome?
She is. But it could be something else, right? Like a peptic ulcer, an obstruction, Crohn's, or...
What are you asking me to approve, June?
C-scope and a G-scope?
Okay, but you could have ordered those anyway.
Right, but not everybody would based on her symptoms, so... Okay, you're the one who's always telling me to watch out for landmines.
Statistically, you know it's unlikely this is anything other than side effects from her bypass.
What I know is that I've made the mistake in the past of listening to statistics over patients.
Keep me in the loop.
Keep you in the loop.
We're monitoring Kelsey Grisham closely. Her father's a handful, but we're on top of it.
Well, let me know if you need any input.
Yeah, I meant to ask, how's your sister? Since her head laceration?
She's healing fine. I doubt it will scar.
Good. The woman she came in with, I'm told that's your fiancée.
She was. Now she's the reason Amira won't talk to me.
Sorry to hear that.
No, Amira, she takes everything on. I think she learned that from me.
Well, you're not alone, Bashir.
Sir, that doctor that you were speaking with earlier, are you hiring a co-chief?
No.
I've been asked to meet candidates and lead the transition to a new chief.
You're being pushed out?
No, let's just keep this between us for now. It's not something I wanted, and to be frank, I don't know where it goes.
But there must be something that we can do.
Let me handle okay. I'll find a way of getting the board back on side again. I know you think you're only here because of me, but you're not. You're here because of you. You understand?
Can we put her oxygen up to 8 liters and find out where her chest x-ray is? Any nausea or cold extremities at all?
Just a bit short of breath. I assumed it was a touch of the flu.
Which could be more dangerous for ALS patients.
You sound like my dad. No, he's not a bad guy. I know how badly he wants to fix me. Or fix this. But when it comes to relating to me, that's all he's ever known.
And what about you? What do you want?
Somehow meet this on my own terms. Buying that bar was a dream come true. And I want to run it for as long as I can.
Your time's up again.
I was wondering if you would consider letting us do a lumbar puncture. It would help us rule out meningitis or severe fever and...
Reconfirm my ALS diagnosis. My father asked you to float that.
Yes, he did.
Resistance is futile with Ray. Is that true about my fever?
But you're in control here. Nothing's gonna happen without your consent. Okay?
Here.
You know, maternity ward's the other way.
I can't go up there.
So you're leaving?
Then I remembered I totaled our car. I just finished paying it off last month, too, after 9 years. I don't even have a job right now.
Ben, why don't you come with me?
I didn't want a baby, Dr. Hunter. Kind of just happened. I thought if I cut my losses now, I'd be doing that kid a favor. I could see you judging me.
Look, I would never say running out a newborn baby is a good idea, but that's not why I'm here. Your spleen is ruptured. You need surgery.
What? So I guess?
Yeah.
Oh, okay.
Imaging's up.
Guys, what's happening? Just tell me, I can take it.
I'm hearing crackles in your lungs.
Crackles from what?
Based on your chest x-ray, it's likely pneumonia.
Wouldn't I be coughing?
ALS makes it hard to cough due to the degeneration of the airway.
Then you accept my diagnosis.
Well, until we get the results back from the lumbar puncture, we have to assume.
He's not doing a lumbar puncture, Dr. Grisham.
Stop trying to work him, Dad. I've done the test. I've come to terms.
Let me talk next steps.
Well, we'll continue O2 therapy, target pneumonia with mycolite antibiotics, and monitor her levels carefully.
Also, we should consider mechanical ventilation.
What does that mean? Is that intubation?
Yes, you're not coughing due to the ALS, which means that without help, your body might not be able to clear the secretions caused by pneumonia.
Dr. Ham is right. It's aggressive, but it's the best way to prevent hypoxia.
Yes, but it's not your only option here. Kelsey, we can try BiPAP for supplemental O2. There's also postural drainage and percussion.
Which might not be enough to keep dangerous amounts of fluids from building.
There's a chance I could still recover on my own, right?
Yes. This is your choice.
And intubation is the right one.
I've done my homework. If I'm intubated, I may never come off the ventilator, right? That's what happens with ALS, right?
No, this is an end stage, Kel. It'll only help you breathe until you fight off the pneumonia, then they extubate you in a day or two.
No.
on, Kel.
I said no, I don't want to be intubated.
Damn it, Kelsey! You need a plan to deal with this. This is what I do. Why can't you trust me?
Because you're not hearing me. Just stop and listen for once. You are doing exactly what you did with Mom. And not just when she was sick her whole life. Your voice is always loudest. If I'm intubated, then you get to call the shots. You get to make all my choices. And I can't give that kind of power to someone who has never listened to me.
Apparently, he wandered into an exam room when a patient was getting changed.
Not intentionally, he's just confused.
We should have located these people by now. What's the hold-up, Arnold?
We're trying.
The reason I put both of you on Kelsey Grisham was to make sure things went smoothly.
Well, I know it took a while to catch the pneumonia. That's because she didn't show the regular signs for it.
Yeah, I understand the diagnosis. What I don't understand is why people I report to are telling me that my resident is standing in the way of a patient getting the care she needs. Ray has friends in high places.
No, but that's not at all how it happened. He was steamrolling his daughter into intubating.
I recommended mechanical ventilation because I think Kelsey should consider it. Dr. Grisham agreed and made a strong case for it.
By ignoring hers.
We are never going to intubate a patient against their will, Mags. You know that. But there's no law against giving an opinion, and Ray feels that you weren't legitimately considering all the options.
Fine. Fine, I'll tread more carefully.
Can you handle this on your own?
What? You're taking me off?
I am ensuring there are no more calls from upstairs.
Dr. Bishop, that is not...
Mags, don't push this.
Since when does Bishop let politics get in the way of a patient?
That's not what he's doing.
Roche, Dr. Curtis, why is one of my post-op patients in the endoscopy suite?
Maya Crawford presented and emerged with significant discomfort. Thought it warranted investigation, so I...
Decided to waste time and resources? Miss Crawford was here 2 weeks ago. Her issue is diet. She's my patient, and I'm telling you, this procedure isn't necessary.
With respect, Dr. Roche, Maya's following her diet.
With respect. They all say that. And when you've been doing this as long as I have, you learn to see the patterns, right?
She's not a pattern, she's a person. Doesn't she warrant the same investigations as any other patient?
Put her back on a liquid diet. If there's no change, I'll be happy to see her again in 4 to 6 weeks.
She doesn't want to see you.
You're out of line, June.
It's fine, AJ. Let's see what she turns up.
She looks peaceful.
Now she does. We just fought over my boob for an hour. She refuses to latch, even though I know she's starting.
You want them to be fighters.
Well, you've met her parents. Oh, speaking of, there was an ER nurse that came looking for Ben earlier. Have you seen him?
He's in surgery.
What?
He had a ruptured spleen, but he's gonna be fine.
Why didn't he tell me? Or respond to my texts? I know we're that couple, that breaks up 1,000 times and gets married to try to save the relationship, and then when that doesn't work... The nurse that was looking for him didn't know where he was. He was gonna leave, wasn't he?
I'm sorry.
That's probably because I didn't exactly let Ben in on my decision to forget taking the pill. But I'm 36 and I wanted a baby.
So you plan to get pregnant?
I know I'm the worst. Money's tight. Things have been hard. I know I should probably end things, but every time I think about doing this on my own, I just chicken out.
for round 2.
Let me help. Oh, yes.
Arnold?
Her BB dropped so I came to check. She vomited bright red blood.
Hemotemesis. I'll ultrasound.
Bleed from pneumonia?
What's happening?
Possible esophageal bleed.
From what?
No, blood force trauma can cause portal vein thrombosis. Could you have genetic varices?
It's possible.
Talk to me. She's going into hemorrhagic shock. We need to stop the bleed.
Rhythms erratic.
Okay, get her on fluids and activate MTP.
Yep.
Unstable VTAC. We need to cardiovert.
Stay with me, kid. Stay with me.
Charging up to 100J. Clear.
Charge it to 200. Try again. Rhythm's going nowhere.
Charging. Clear.
We're losing her. We have to do something.
I could do a Blakemore.
It's risky, considering the ALS could damage your airway.
We don't even train for that anymore.
No, I know how, and we need to stop the bleed.
You do it.
It has to be Dr. Hammond.
Please, save my little girl.
Give us room to work, Dr.
I'll check the Blakemore kit. I need a laryngoscope and a portable X-ray to confirm placement and have 50 mics of octreotide and a gram of ceftriaxone ready.
On it.
Mags,
What?
you almost done?
There's other terminals.
What's up?
I think I hate everybody we work with. Except you, obviously.
Yeah, we'll give it time. If there's one thing that I've learned, it's that everyone disappoints you eventually.
Dr. Grisham? The surgeons will update us as soon as they know more, but we stopped the bleed long enough to get Kelsey to the OR.
Thank you. Thank you, Dr. Hammond. My daughter didn't even want to tell me she had this horrible disease. She needs to know I'm listening now.
Why would Mel play my voicemail for her lawyer?
So he could play it for yours, before we all have to hear it in front of a judge. All you're doing is making this worse, Theo.
It's her lawyers that are making this worse. They're acting like nothing good ever happened between us. Suddenly I'm this villain who isn't worthy of parenting his own kids.
Theo, you chose to take a job in a different city from your family. You can't erase that. Of course she was going to ask for custody. And as your lawyer, I'm telling you that if you don't stop being so stubborn, then you could lose everything.
Dr. Curtis, Maya's having some kind of episode.
She said her heart's racing. She's shaking like a leaf, so I'm putting her on a monitor.
Can you do bedside glucose?
What's wrong with her?
She's tachycardic. Maya, if you can hear me, can you say something?
Something.
Okay, good.
So there is a problem? The testing, what did you find?
Nothing.
Yeah, there's no blockage, no polyps, no ulcer. Glucose 3.4. All right, she's gonna need 1 amp of D50. Then can you just give us a second?
What does that mean, the glucose?
Well, rapid emptying can cause acute episodes of hypoglycemia. It's hard to keep your sugars stable when your body rejects everything you put in it.
So we're back where we started with you telling me to eat less.
No, Maya, that's not what I'm saying. You haven't done anything wrong.
And why is this happening?
I don't know if Dr. Roche made this clear, but gastric bypass is a complex surgery and it can have various outcomes.
And mine varied into hell.
You had an extreme reaction, and it's going to take some time for your stomach to recover so you can intake normally.
I didn't even want the damn surgery in the first place. If I'd known it would be this bad.
There's nothing else you can do. Well, there are some medications we can try. You know, They slow the emptying from the stomach to the intestine, and I can find you a nutritionist who's committed to something called Help at Any Size, and they help you manage your meal and side effects.
Except what if I never adjust? I just live like this.
You come back here when things get bad again, and bypass reversal is an option.
Reversal? You mean more surgery?
If you're serious about wanting another choice, then yeah.
Could that make things worse?
It's an open surgery, so we can have complications. I would talk it over carefully with your surgeon, but I can refer you to someone who is not Dr. Roche. Think about it, Maya. I'm here if you need me.
The surgeons managed to repair your spleen. A couple more days, you'll be up and around. Ben, I didn't mean to judge you before.
I thought we could call her Crash. Dr. Hunter, do you mind bringing her to her daddy?
Hello there. Oh my God, hi. Welcome to the world.
She has your eyes.
I love you, Tess.
I love you too. We can make it work, I know it.
Here, it's a beat-up 2013 sedan, but she's got some good miles left in her. And there's an old car seat in the trunk.
You're giving us your car? Dr. Hunter, I mean, thanks, but
You're gonna need one.
That is so generous, but we can't accept.
You have to. I need to purge a few things. Hey, I'll start jogging to work, so I mean, really, you're doing me a favor.
we don't know what to say.
Just say you'll give that kid a great life.
They stopped the bleed, but apparently the Blakemore tube damaged the airway. They had to do a tracheotomy.
I was careful with the inflation.
I know. And the surgeons agreed if you hadn't acted, she would have died. But her body is weak and it couldn't take the pressure. Kelsey will live, but she'll be attached to a ventilator for the rest of her life and unable to speak.
Oh my God. This is exactly what you didn't want to happen.
I'm sorry, Bash.
We made the call together. A lot of doctors would have been paralyzed. You stopped the bleed.
And then ruined this woman's life.
Could have easily rolled the other way.
But it didn't.
You want to see me?
Got called into a meeting. Roach isn't happy about your little dispute over Maya Crawford, and she's making it known to the division heads.
I came to you for advice. Just let me walk right into that.
I didn't tell you to go toe-to-toe with the head of GI.
But you stood there and watched it happen. I thought you had my back.
You made an enemy of the wrong person today. Maybe stop at one.
I see something else calling.
Sir, we need to talk.
You're never wrong to fight for your patients, Max.
Thank you. Although I'm not sure that actually counts as an apology.
Ray was out of line, as was I. Why do I get the impression you're here to register another complaint?
Cardiology. I told you I wanted to explore it, but you didn't hear me.
You also told me Emerge was the only thing you ever wanted. Well, what's changed?
I don't know. I just know that I can't get it out of my head, and you need to let me explore my future, even if I mess it up.
Well, I'm hearing you now. Don't like the idea of sharing you with another department, but if it's what you want, I'll talk to Dr. Fisher.
Appreciate that. You should really watch your sugar intake.
His eyes are green. Actually, they're sometimes blue. And he's funny.
I'm sorry. Sir?
No, this is important. You know, he gets very frightened when he's on his own.
Gilbert.
Claire, where have you been all day? When did I get to the hospital?
This morning, sir.
Oh, right. I'm looking for Peter. We lost him again.
Well, your cat lives with your son in Belleville. Andre takes very good care of him.
Peter's a cat. Hmm? You never mentioned that.
You never asked.
Hey, I think I have your son's number on my phone. Should I give him a ring?
Never leave again. Also, Bishop needs to see you in his office. How about you tell me more about your cat?
Oh, okay.
Congratulations, Claire.
You're gonna feel really bad if I failed. Oh, thank you.
I had a chance to fix things. To get to know her the way I should have. Now, I never will.
I'm very sorry that it went this way.
After what you took from us? Sorry won't be good enough, Dr. Hammett. This is your fault.